Greetings. Let us talk about hand hygiene. This is one of the most important practices for every healthcare worker to block or interrupt the chain of infection that happens in the healthcare setting. There are a couple of ways that infection can be transmitted. One is either droplet or airborne transmission when somebody coughs and sneezes. And the second one is from fomites or touch surfaces. And in order to block this chain of infection, hand hygiene is the most important step. You undertake hand hygiene when you enter the endoscopy room and before you go to the patient and do anything, i.e. repositioning the patient, giving IV medication, or even introducing and shaking hands with the patient. And after you finish the procedure, before you go out of the room, it is important to wash your hands. Hand hygiene practices involve washing the hands with soap and water or using a hand sanitizer. Among the two, wherever possible, consider using hand washing. Hand washing should be done religiously. It is just not equal to washing hands. There are a series of 10 steps that you should practice, and you should practice it thoroughly so that you don't have to think in between the steps. And let us go through these 10 steps. And you should wash your hands for at least 20 seconds. So let us go through this. Step 1, cover the palm with soap and with adding a little bit of water, create a nice lather and work on your palms in between the fingers and the webs of the fingers, in between the fingers, inside the fingers, webs of the thumbs, tips of the fingers, and finally wash your hands with water. Dry the hands and close the faucet with the disposal towel. It takes about 20 seconds to perform these steps properly, and make it a habit to follow a particular routine so that you cover the palms, back of the hands, webs of the fingers, in between the fingers, inside the fingers, tips of the fingers, webs of the thumbs, etc. So make sure you practice the steps and do it religiously for at least a minimum of 20 seconds. This is what it takes to clean your hands and get rid of any bacteria or viruses that you may contact by touching on different surfaces. And this will protect you from getting infected. If you want to touch your face, eyes, nose, mouth, think about washing your hands before touching the face. And this is one way you could protect yourself from getting infected in the hospital. Say, for example, you're about to go into a patient's room and you've already washed hands before. And if there is a hand sanitizer that you want to do, let us look at how to use hand sanitizer. It should be an alcohol-based hand sanitizer. and you want to clean the hands again in a stepwise manner. And let us go through the steps. Put some hand sanitizer in the palm of the hands. Rub the palms, back of the hands, webs of the fingers, in between the fingers, inside the fingers, webs of the thumbs, tips of the fingers, and then let the hands dry, air dry. Do not use a wipe to wipe off the hands. Let them air dry. Hands are safe when they are dry. And this is another method of hand sanitization. So let us look at the chain of infection. Susceptible hosts, elderly, children, immunocompromised are especially at high risk, and you have a duty to block the chain of infection by practicing proper hand hygiene. Thank you.